So I'm Matt Davis. I'm a neurologist and a sleep specialist. I'm in solo practice on the Jersey Shore. So far and away, for narcolepsy and other hypersomnia disorders, far and away the biggest barrier is disease recognition. It is such a misunderstood diagnosis. It is often misdiagnosed. People go 10, 15 years sometimes, or even longer without a diagnosis because it is just not well understood in the public and even in the medical community what this is. There's this Hollywood version of narcolepsy that is portrayed in the media as this like punchline of a joke. And people see this and think that's what the problem is. And when their symptoms aren't that, they don't think to do it. I have patients regularly who come to me with classic narcolepsy symptoms and then say to me, but it's not like I have narcolepsy, because they saw some movie or TV show that portrayed it in this sort of silly way. So far and away, that's the biggest challenge. I think the opportunities we have are related to that. There's a lot of room here for improving diagnosis, for improving recognition, really educating our peers about these disorders, not just what they look like, but why they're important to treat, how they can affect people's quality of life, how they can affect, people just aren't at their best in this kind of prime time in their life. A lot of these patients are very young, and we want them to sort of succeed, and this disorder is really pulling them down. And so we have all of this opportunity to help people with this with greater recognition. And then the therapeutics that are available, we still don't have a huge number of options, but we have more and more every year. And tailoring treatment to each individual patient's symptoms has become it's become more specific, more easier to do, because we have some more options than we used to. So I think very broadly, oxybate therapy is probably far and away the single most effective treatment for patients with narcolepsy and with idiopathic hypersomnia. We have 20 plus years of use of Oxybate, initially as XYREM, then as XYWAVE, and now with the introduction of LUMRYZ. They are all basically treating in the same way. Each one has their own advantages and disadvantages. But that medicine is really done the most for the most number of people. It's not right for everyone. There are some side effects and concerns. It is a serious medication, but can be enormously helpful. And I really encourage my own narcolepsy patients, if you haven't considered using an oxybate therapy, you kind of owe it to yourself on some level to consider it, at least, because it can be so I hesitate to use the word life-changing, but it really can make such a difference in the care of these patients. So the formulations we have, XYREM has been around for 20 plus years. It is taken twice a night. You take it at bedtime, you take it 2.5 to 4 hours later. There's a fairly substantial salt load with XYREM, because it is the sodium salt of GHB, sodium oxybate. XYWAVE was developed a few years ago as a low sodium version of oxybate, so it still is the salt of GHB, but it uses other inactive ingredients to help it absorb calcium and magnesium and potassium. The active ingredient in these is still GHB. They're both taken twice a night. But because of just the concern over long-term use of a medicine that has a high sodium content, XYWAVE was developed for that reason. My opinion is that when, all things being equal, XYWAVE to me makes a lot more sense than XYREM, because otherwise the drugs are taken in very much the same way. Most recently, LUMRYZ has been developed, which is sodium oxybate, but the way of taking it is so different. You take it only once a night, that to me changes the playing field a little bit. And in some patients who had trouble being compliant with the twice nightly regimen, people who wouldn't even consider it for that reason. Then we weigh, is the excess sodium, how much of a risk benefit analysis is it there? If we can treat this disorder, is the excess sodium in these patients actually okay? And in some, the answer is yes, some the answer is no. That's why it's nice to have all these options. But again, the drugs are in essence still doing the same thing, in the brain and how it treats symptoms. But it's nice to have this variety of options of how to administer this very effective therapy. And if we can offer it to more patients by using these different formulations, I think there's room for all of them. It's a wonderful thing for this misunderstood, unrecognized, or under-recognized, underdiagnosed disorder to sort of get its moment in some way. Again, the more we drive recognition, the more we drive better understanding of the disorder, the more those of us who feel so passionate about this can get together with each other, but patients and patient advocates and industry and pharma and insurance. The more we can sort of get together and have these discussions of how best to diagnose, how best patients can access care, I think it kind of helps the whole cause. And so it was really, truly a wonderful thing to see. And I think, the charities and patient advocacy groups for narcolepsy everywhere, Wake Up Narcolepsy put on this event, but Project Sleep and the Narcolepsy Network, all of these other charities that are sort of driving better understanding of the disorder and access to care are all doing, very good work.